Hello and welcome to our sit-to-stand movement analysis.
Meet Grandpa Jim. This is Emily's grandpa.
Aren't they adorable?
This is Grandpa Jim's medical history. Most notable to our motion is his total hip replacement 7 months ago.
He follows the precautions of no internal rotation, no flexion past 90 degrees, and no adduction.
His medications include the following.
His social history states he is a previous smoker and he consumes 2 alcoholic beverages a day. Patient used to be an avid runner and golfer, and he worked as a chemical engineer at a local power plant. He received a hip replacement as he was no longer able to do several activities such as mowing the lawn, getting out of a chair, driving a car, cooking meals for his family, and attending special family occasions.
Here is Grandpa Jim performing the sit-to-stand. As he progresses through the movement, it is clearly broken down into 3 separate categories which we have analyzed. Beginning with phase 1, also known as the shift phase, Grandpa Jim slides towards the front of the chair and prepares to rise. Before analyzing the movement, we must note that gravity does not play as large of a role in this phase as it does in the others. His hip begins in 70 degrees of flexion. As the movement begins, he concentrically contracts his hip extensors and moves towards extension. Once he reaches 35 degrees of flexion, the movement changes as his hip flexors begin to contract concentrically and his hip extensors begin to contract eccentrically towards a position of 90 degrees of flexion. Grandpa Jim's knees begin at a position of 80 degrees of flexion. However, as the femur moves forward, the quadriceps must contract eccentrically to control that forward movement, ultimately resulting in 90 degrees of flexion. Moving down to his ankles, they begin in a neutral position or 0 degrees of dorsiflexion. As the tibia progresses forward, there is no concentric contractions of the lower leg. However, the gastroc-soleus complex contract eccentrically to control that forward movement, ultimately resulting in 20 degrees of dorsiflexion. It is important to remember that during this movement, gravity does not play a large role in impacting his muscle activation. However, it does play a large role in the fact that he has to move his center of mass forward before beginning for the rise phase, as represented by the red lines on the screen.
Next is the rise phase. Grandpa Jim began the rise phase with his hips at the edge of his chair and his feet touching the floor. This phase of movement required higher forces of activated musculature to overcome the downward force of gravity. Let's start at the hip joint. The hip joint was in a closed chain flex position of 90 degrees. When he moved from sitting to a position of partial standing, the hip joint moved from 90 degrees of flexion to 45 degrees of flexion. The muscles Grandpa Jim used to perform the concentric hip extension included the gluteus maximus, semimembranosus, and semitendinosus. Next at the knee joint, we see it's in a closed chain position and flexed to 90 degrees. The knee moved from a position of 90 degrees of flexion to 20 degrees of flexion. The primary movers for this concentric action were the rectus femoris, the vastus medialis, intermedius, and lataris muscles. While extending, the femur moved over the tibia, which created an internal rotation of the femur and an external rotation of the tibia due to the closed chain properties of this action. Next at the ankle, we see it's placed in a closed chain position of 20 degrees of dorsiflexion. The ankle joint moved from a position of 20 degrees of dorsiflexion to 10 degrees of dorsiflexion. The muscles used to reduce dorsiflexion were the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius, which are eccentrically contracted. Ultimately, the tibialis posterior, flexor digitorum longus, the peroneus longus, gastrocnemius, and soleus were also activated concentrically in order to steady the leg on the foot and aid in the reduction of dorsiflexion.
For our final movement analysis, we're looking at phase 3, the stand phase. Grandpa Jim is currently in motion for his final elevation from a partial standing to fully erect static standing position. Looking at his hip, knee, and ankle, he is currently in a flexed hip position of 45 degrees, a flexed knee position of 20 degrees, and a dorsiflexed ankle position of 10 degrees. One main component to consider of this final rise is the force of gravity, causing Grandpa Jim to use more muscular activation to overcome the external force of gravity. Another aspect to consider is Grandpa Jim's recent surgery and his degenerative changes due to his age. These changes will be most notable at the completion of the movement when Grandpa Jim remains in a slightly flexed position at the hip and knee. Beginning the movement looking at the hip, Grandpa Jim is extending from a 45-degree flexed position to a 5-degree flexed position. This is happening through a concentric activation of the hip extensor muscles such as the semimembranosus, semitendinosus, biceps femoris, and gluteus maximus. Moving down the chain, looking at Grandpa Jim's knee, he is extending his knee from a 20 degrees flexed position to a 5 degrees flexed position. This is done through a concentric contraction of the quadriceps muscles, pulling his knee into extension, although it is not fully extended, as you can see in the photos. The final joint at the talocrural is plantar flexing, although remaining neutral, moving from 10 degrees of dorsiflexion to 0 degrees. This is completed through a concentric contraction of the gastrocsoleus complex and an eccentric contraction of the tibialis anterior. As previously mentioned, Grandpa Jim completes his movement with a partially flexed hip and a partially flexed knee as a result of his surgery and degenerative changes. Once he comes into a fully standing position, he requires more muscle activation while standing to remain upright.
Referring back to the ICF model, we were reminded that his total hip replacement was due to osteoarthritis, that the main body structure and function we are looking at is decreased range of motion. The activity we focused on was going from a sitting position to a standing position, all of which play into participation in golfing, mowing the lawn, attending family occasion, and as our patient said, goofing around. So now we will watch Grandpa Jim perform the motion one more time, and as he begins goofing around, we will open it up to questions.